Good afternoon, members of the media. Thank you very much for joining us here today. From the 20th of April until the 27th of April, the region of the Americas will be celebrating the 17th anniversary of Vaccination Week in the Americas, as well as World Immunization Week, under the theme, Protect Your Community, Get Vax. This year, there is a significant focus on putting an end to the current measles outbreaks and preventing future outbreaks. Currently, there are ongoing measles outbreaks in the Americas, even though in 2016, the region had declared itself free from this disease. Since 2017, the region has suffered from measles transmissions with more than 17,000 cases. In 2019, 10 countries in the region of the Americas reported confirmed measles cases occurring. Those countries include Argentina, the Bahamas, Brazil, Canada, Chile, Colombia, Costa Rica, Mexico, and the United States of America, as well as Venezuela. The outbreaks in Europe also remain a threat to the importation of the disease. Bermuda has had no recorded cases of measles since 1991. However, 28 years of measles-free history is now currently under threat. Our excellent track record is no reason for us to be complacent, because not only is measles on our doorstep, being one 90-minute flight away, considering the recent outbreaks that we've heard about in New York City, but also because in Bermuda, we have detected high levels of vaccine hesitancy, which means that not enough people have been vaccinated to give our people herd immunity. In other words, measles, which is highly contagious and can easily spread to others through airborne droplets from sneezing and coughing, could spread through Bermuda's unvaccinated population rapidly, causing major disruption to schools and businesses, unnecessary pressure on our healthcare resources, and could put lives unnecessarily at risk. Our most recent data in 2018 has shown significant improvements in vaccination coverage of 95% of all infants at 6 months of age compared to those figures in 2017. However, there is real concern about immunization coverage for the first dose of the measles, mumps, and rubella given at 15 months of age, which was only at 87%, and this is significantly below the global target of 95% coverage. Low vaccination coverage increases our community's vulnerability to re-emerging vaccine-preventable diseases such as the measles. And in addition, Bermuda is a major travel destination and is at an increased risk for importation of many of the vaccine-preventable diseases such as diphtheria and whooping cough. This is very concerning for Bermuda and poses significant implications and risk from vaccine-preventable diseases. Risks include an increase in vulnerable populations who are unvaccinated, a return of diseases to Bermuda, the impact on our health on infants, adults, children, and pregnant women, and an impact on resources tackling outbreaks of disease and lower health indicators as a country. In order to address this issue and to ensure that we have strengthened community participation with all of our partners in our immunization program, to implore system changes through a national strategy of vaccine hesitancy. The Ministry of Health has developed a national plan to address vaccine hesitancy. Our strategy aims to increase Bermuda's vaccine coverage by 10% by the year 2021. Specifically, we will do the following. We will implement a web-based electronic immunization register to strengthen accurate and timely and efficient reporting of vaccines from public health clinics as well as the private sector partners. This initiative has been supported through the Pan American Health Organization, and a representative was on the island during the week of the 18th of February to provide an assessment and assistance for Bermuda. In addition, Bermuda will adopt the World Health Organization's evidence-based guide for addressing vaccine hesitancy, referred to as Tailoring Immunization Programs, or the TIP guide. This week provides a great opportunity for all of our countries throughout the region to do their part to end the current measles outbreaks, protect their communities, and sustain the gains achieved in immunization for the health of us all. Safe and effective vaccination, along with other hygiene practices, is one of the most effective public health interventions known to medicine. It is important to take action as Bermuda's vaccination coverage is suboptimum right now, and we must act urgently and now. The Department of Health will use this week to address public concerns about childhood vaccination. We are committed to fostering community participation, advocacy, and the development of information platforms, tools, and messaging targeted to specific groups. This week, we invite parents and the general public to visit one of our health centers for updates for their vaccine cards. And in May, a forum will be held on vaccines with a guest speaker from the Children's Hospital of Philadelphia who will speak to parents and adults who have concerns about vaccines. The public is invited to attend this, and more information will be coming, but I can tell you it will be at St. Paul's Centennial Hall at 5:30 p.m. on Tuesday, the 7th of May. To close, I remind us once again that Bermuda and the world are now at risk of diseases that medical science and public health eradicated over a generation ago. This is a terrible indictment on our population, and we must try and we must do better. The highest quality research has proven time and time again that fears about vaccinations are completely unfounded. And all of the evidence available makes it clear that the complications from these diseases are much worse than people believe, and they're not worth the risk. I implore all young parents in particular to follow the footsteps of their parents and their grandparents who welcomed preventative measures and made Bermuda free of these diseases. With little effort and with no cost, we can keep it this way for our children as well. Thank you very much, and please remember, Bermuda, vaccines do work.
Any questions?
Good afternoon, Minister.
Good afternoon.
Could a low number of people locally getting vaccinated be down to people believing that they were already vaccinated as part of their childhood vaccinations?
Well, what we're seeing, as I revealed in the statement, is that we're seeing a decrease in the amount of vaccinations for persons receiving their first dosage between the ages given at 15 months. So you may remember the MMRs, measles, mumps, and rubella shot, which is given at 15 months. That's where we're seeing the decline in vaccination. So it's not the adult population, it's the children at 15 months that we're seeing a decline from the global target of 95% to 87%.
So those vaccinations that the children are not getting, they're not obviously not mandatory.
Well, there is a body of evidence that supports the importance of vaccinations. There is a school of thought that says that whether or not perhaps the Children's Act, as you read it, would indicate that it should be a mandatory vaccination to ensure that you're protecting your children. But at this point, insofar as the interpretation of the Children's Act and the like, it is strongly recommended that vaccines take place with respect to children.
Could we come to a point where such vaccinations could be mandatory, like in the U.S., for example?
I thank you for that question. Certainly, as I've indicated previously, there is a strategic framework that the Ministry of Health has developed, and they're hoping to see an increase in vaccinations by 2021. However, I can say it is certainly not out of the question that the government may consider having to take further measures, because we are seeing, as you've indicated, in many of the United States, as well as the District of Columbia, where there are requirements for children in order for them to be enrolled in school, they need to ensure that certain vaccinations that are required are taking place, unless there's a medical reason, as prescribed by their pediatrician, why that vaccine should not be administered to the child. In fact, in December of last year, I received a letter signed by all of the pediatricians in Bermuda supporting further steps to be mandated by the government to ensure that all children that commence school have received their requisite vaccinations.
Thank you, Minister.